Dr. Perlmutter, tell me about your patient today.
Okay, so this patient has a cancer of the lower lip, and unfortunately, it was managed as a cold sore for a number of months. So it grew to a fairly large size and invaded deeply, etc., etc. So we're giving her radiation therapy and hyperthermia, which will probably be curative, but it's prognosis is a bit guarded because it did grow to be so large and deeply invasive.
If this doesn't take care of it, what is the next step?
The next step would be a fairly big operation.
A surgery to remove it.
Right.
And then what? Plastic surgery, I would guess, to fill in the portion that was cut away?
Yes.
Well, what is your prognosis? Have you seen a situation like hers before where?
Yeah. We actually have someone who's just finishing up treatments down in Homestead for exactly the same problem, and he's doing very well. I mean, he'll be cured, and hopefully this patient will as well.
She's very concerned about how it looks and that the treatments will make it look worse. At some point, will it start to heal?
It will start to heal during and after the treatment is complete. And one of the reasons for doing radiation rather than surgery is that in the long run, it'll look better with the radiation. But I mean, basically it goes through a process where it becomes inflamed, and there can be some scabbing, and that doesn't necessarily look good during the treatment itself.
So sometimes it gets worse before it gets better?
It can get worse before it gets better. She also had a number of spots on the skin between the lip and the chin, which were very suspicious for some spread, and those have gone away already. So that's a very good sign.
So if she would have had surgery, what would have that looked like?
It really depends on the skill of the surgeon, but the lip could be contracted. There could be some problems with drooling, and if the surgery turned out to be not complete with close margins, etc., then she would have needed radiation anyways. And if there's a graft, usually it doesn't look exactly the same color as the regular lip, so there's a bit of a cosmetic defect.
Is your advice to people, if you can avoid surgery, it's better than go with radiation?
For the lip, I would say so. I mean, for skin, the two approaches are equally good. They're equally fine. But for the lip, it is better to do radiation, yes.
What is your advice to people? Like, this is the second patient I've seen now who was misdiagnosed as being a cold sore. What advice would you give to people who are maybe being told the same thing? What should they be doing?
I mean, in defense of the primary care doctors, 99 out of 100 times a sore on the lips is a cold sore. But if it's going on for like 4 or 6 weeks with the kinds of treatments that are usually done for cold sores, and it's not getting better, and in fact it's getting worse, then you need a second opinion. Ideally from a ear, nose, throat doctor, even from a dentist, or from just a different doctor. It could be a different primary care doctor, but you can't just keep receiving exactly the same treatment and it's not working.
A dermatologist?
Dermatologist would also be an outstanding choice, that's correct.